それでは、いよいよ今日一日の私たちの、メインの、時間になりました。今年も元気に、Dr. Beach は私たちの前に姿を見ていただき、役に立つ話、明日にすぐ役に立つ話もあるかもしれないし、立たないかもあるですね。で、今ちょっと美先生に私ちょっと申し上げたんですが、ここで私たちがこうやって集まってる、私午前中もちょっと申し上げましたが、開業医ですからそれぞれの置かれた条件は違う、いくつかの違う条件いっぱい皆さん持ってる。だけど実は共通したものはこれが一番メインだというふうに申し上げた。美先生もその話を申し上げた。でそれは実は PD だという話を美先生は今おっしゃっている。今日はその話になるかどうかは私全く存じませんが、今日一日メインとして美先生のお話を伺うことにしたいと思います。
I can still stand up and I can still walk, but I have a cane to help me walk, okay? And but if I have to, it's nice to have a walking stick. But it's nice to be back with you again, and with a group in which we have a very close common interest. And in every person as a person, we have what we have in common with others. This is our social relationship. In common with others, and as a person, there can be some difference too. And of course, I was just mentioning to Dr. Ishida that I came recently from the south anyway, and I've been working closely with government there because and there's a very different way of thinking, but I'm very aware that the group here are people in small business and private, and you have to run your problems and in a small business thinking. In the slides we selected some slides, and I'll bring this up later in one of the slides we show. But so much has changed recently in what I call the technology based on ICT. Our work started where we really got organized in our interest in the relation between PT, which is position technology, and TT, treatment technology, especially focused on procedures in the mouth. I don't like to say dentist. Dentist is too small. I don't use that word anymore. We are not dentists. We are mouth specialists, because everything we do is in the mouth. So we can think of PD. It started with it's personal.
Excuse me.
It starts with each person themselves. And what's an interest to me as a person, and what's the interest to as a person, person by person. Each of us vary there. We know no two people can be exactly the same. Yes, I think it's a good idea to follow slides here so we can make it. This is a quick report of what I've been doing this last year. Preparation of EASE 123 in China is in progress. How many here are using EASE 123? Oh, several. Okay, then you probably know what I'm talking about. The others. But EASE 123 is, of course, ICT. It's a product name, actually. And we got a contact from a Chinese company that they wanted to adopt our system. They want to link with the Japanese ICT programmers and Chinese ICT programmers. They work together. Those in this group who are working with EASE 123 probably know what I'm talking about. Those who don't probably say, well, this is not what we're familiar with. But they the Chinese president of the Chinese company came to see me. My first question is, why do you want it? He said, we want it because it is based on digits. And digits are global symbols, and it's going to save us a lot of money to translate Japanese to Chinese through digits. Because it will not only be Chinese, but it'll be all languages in the world. That's global. So the reason that the Chinese company wants to join with Japan is because all of our content of our website, of our programs, are in digits, which is a global language. And it's probably one of the few global languages. Digits, everyone knows, and engineers know a lot about digits because that's what they have worked with. So this is one problem we're working with at this time, linked to China. Professor Bian from Beijing, he is a professor at Beijing University, which is the top university in China, same as Todai. He visited Osaka and Yugawara, which he is he's a professor in a university, and he is very familiar with language, but the motor performance aspect, or the aspect that we work with, is the control of the fingers, and he wanted to know more about that. So he is the key person between China and WHO. Today, China is, because of the economy, is catching a lot of attention. We can't ignore it. So we spent a week in Dr. Sitichai's office, and also a day in Dr. Yama's office in Osaka. These are two PD clinics, and both Dr. Yama and Dr. Ish, I work with very closely with the rules of PD, with the content of PD. PD doesn't really have a rule. It's a natural use of the body, so we don't need rules of PD. If it's based on the natural use of the human body, we don't need rules. But to change habits, we need rules. And we all have habits that we have to change if we're going to adopt PD. PD, positions and habits, or positions and movement, is based in a natural use of the body, and it's unfortunate we have to really teach it. It's something we best wouldn't have to teach it. So many times we use questions rather than show how to do it. And it comes by questions that people catch on, and that's where D comes in derivation. So in courses I've presented around the world, a large part of the center time is asking questions and analyzing the replies, because there's many habits in different parts of the world. And I'm not one to say, I know your habit will change. So we only start with questions. But if based on questions, that is D. You have to derive the answer, and the members are asked to derive it. So that's why I call it PD. P is based on what is P? It's based on the stretch of muscle. That's one way to say it. And other tissues of the body. If I close my eyes, what I feel is what you see. Which way is my arm extended? You're seeing it, and your answer is what you see. Well, your arm is extended to the right. But I don't see my arm now. My eyes are closed. I don't see it. But how do I know it's to the right? It's based on the field of tissue stretch. And I'm stretching long ways. Well, in our website we have a lot written about it. You've looked into it, I'm sure. And you probably have many questions that might relate to that. But that's my simple way that I often put it across. in courses where I'm in many parts of the world. In January to March, for two months, I've been in Chiang Mai, which is in Thailand, and this in Thailand. Chiang Mai is the city where WHO first sent me to Thailand. WHO was interested in what I was thinking, but they didn't know exactly how it fit with WHO's organization. But they sent people from many parts of the world to HPI to check what we were doing. And after, I did not decide to go to Chiang Mai. It was not my choice. I didn't know. The headquarters of WHO is in Geneva, Switzerland. And after sending many people from many countries in the world, WHO decided that I should go to Chiang Mai, Thailand. It was decided by them, not me. Okay, I'll go. And so that was the starting point. And they particularly wanted me to work with a person who had founded the second dental school in Thailand, which was in Chiang Mai. Her name was Dr. Daryl, because they felt that her problems and her way of thinking was very similar to mine, and they felt I should really work with her to start. So that's why I happen to be there. And so I've been returning there frequently because we got a connection with many people there. So I've been going there annually, usually for 2 months. This year I was there. Now next month, Dr. Tala is coming, and also Dr. Sidiwang from Thailand is coming. And Dr. Tala has a very interesting brain, but he's also in our group. The PDP group, of course, is very much focused with activities in Japan. Because of our contacts with many countries, we feel we have to have some global connection, and therefore it's very important. We have what we call GEPEC is another global. It starts with the word global, and the first word is global. It probably has a very close relation to our thinking. My network, the first is global. The global network for systematic healthcare. You notice the first word is global. But if the organization says, I'm a member of the Japan Dental Association, that's Japan. Or if I'm a U.S. Dental Association, it's U.S. And whenever I go to different countries, they talk about their associations in their nation. I say, I don't have that interest to relate to those kind of groups. Because we are thinking global and local. And because we have been oriented to linkage of global-local. Land is local, and as you know, I work in Land Center today, which means local area network. And on the other end, we have a global network. And you notice we immediately after this network started, we said global and local. Well, websites. The first website, I mention it now here, was established in 1991. And the first program in a website was how to make websites. Now, websites recently have had a very strong influence on global linkages of people. And of course there are websites that start with the name of nation. I mean, I think the Japan Dental Association probably has its own website, I suppose, but it's in Japan. So we've had much difficulty in dealing with nation-centered websites versus global and local linked website. And ours is a concept here. But anyway, I'm saying something that's been a big problem for me, and I'm letting you know about it. Okay, next slide. We are now, my main job at this time is an update in our website. And this is the front page. And this is the world of nation borders. Nation, 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 nation. This is what I feel should be the emphasis in a global network. And that's the conditions and use of the human body. This one represents the health condition of the human body. Your first question, if you see the inside, what's the condition of it? And this relates to health. And you notice the digits here related to muscle. This is the use of the human body. This is the special interest of PD. This. So if you link it with our website, you say, well, the PDP is really centered on this area, but we have to also consider its relation to the problems of the human body, which center in the problems of health. So these two graphics indicate the key things that we deal with in our global center. It's the relation between the health condition of bodies, which is our objective for use of the body in our group. This is the use of the body. This years ago, you may have seen this, but it's kind of recall of things that you might have known. And by the way, those in the members who would like to have meetings with me on coming into more detail like that, I'm retired, so I'd be happy to have the meetings with members that have special interest in that. So if you're not the people who have the interest in it, well, this is good. And of course, we have some things here. In all of our life, our body conditions, we are either walking or we are laying, we are at rest. And this is a reference condition, for example. We are sitting. Today, almost everybody is sitting down or standing. At the moment, I'm standing. And in our life, we're in one of those basic positions as long as we get. So, someone has called me a position expert. And they said, does he have any expertise? I focus on position, starting with position of human body. But that relates to positions of everything around us. We can't stop at position of the human body. We say, what about the position of that table? That's the position of this item related to this. These are all positional relationships and what we're paying attention to. So position, but the position starts with position of the human body. And this moment, the group here are a group of human bodies looking at this display. And I'm a human body trying to explain something about this display. But basically, we have to recognize we are all human bodies. So, okay, next slide. Oh, PD life. I don't think I've ever presented this in Japan, but we've had many courses in Korea. That's one of the countries that we present in. And key contact there has been Dr. Kim, who recently died. He died very suddenly and very easily. That's the way I'd like to die, when he died. And by the way, if you come to our office, Land Center, you will see this hanging above my desk, and there's a big display there. Dr. Kim is very observant. He caught interest in PD as a concept. And his idea is, do you want PD only in your dental office? Or do you want PD for your whole life? When he first asked me about that, I was getting kind of dizzy, you know. And he's very observant. For example, I one time came with one suspender to hold my pants up. Nobody would notice that. But he did, because the habits of almost all people is two suspenders, one here and one here. Why do you have only one? He said, oh, PD. This one suspender is PD in comparison with two suspenders, but it's comparative. Why? It takes less effort for me to put my clothes on and take my clothes off every day with one rather than two. So I was thinking, why do I have two? I threw it away. This is one. Dr. Kim noticed this, and this is a big, many people in Korea are very conscious of one suspender. This is PD. And that's just one observation. He's very, and automobiles and everything, he was thinking about PD life. And so coming back home, what we have on here, though, I have to explain what we got up here. This red is proprioception. And why is it red? Because this is a muscle color. It's based on muscle. Or tissue, the body tissue. And that's information based within our bodies. P. Especially muscle, but not only muscle. Muscle and other tissues related to it. But then, next, D is conclusions from P. What we conclude from P test. So P is a testing condition, and from that we make conclusions. This color is the gray matter of our forebrain, because we make conclusions up here. That's D. So P is in here and D is here. It's from, and then what is with these conclusions? What do we come up with? Today, people like the name freedom, and we do all want to be free of being locked in anything, I think. And that's a basic global one. But especially this is emphasized in the U.S. maybe excessively. But basically, we want to have freedom from adaptations and habits. So PD is basically, we can see PD as freedom from habits. We live with our habits, and once we get habits, it's very difficult to change habits. For example, medical and dental schools make habits, establish habits for clinicians, medical clinicians. But in HPI, we were changing habits. It's much more difficult to change habits than it is to make a habit. When we began to spread throughout the world and be exposed, we were seeing habits all world, things I couldn't imagine. We were so surprised. Well, it relates to skill. A person who is 100% skillful has no habit. He's completely PD. 100%. That would be a reference of a goal which almost is very difficult to achieve. But in comparison, we can say PD. So PD has two meanings. It means proprioceptive derivation, or it means proprioceptively derived. The second one has more use for us because it comes to this was a test, and we proprioceptively derived the result. I don't know, in my early years, when I got into this, and we began to say that this was PD or it's not PD, why, of course, especially salespeople selling instruments or equipment, they bring up an instrument, and they wanted my answer quick, because they're salesmen and they want to sell. They would say, they would take a, this is the only instrument I can see around here. It's a writing instrument, it's an instrument. And, is this PD? Yes or no? If I said yes, if I said no, they were angry because they were so strong in this because of their habits. And it was meant you didn't agree with their habits, or you agreed with their habit. Well, I don't know how many were coming at the starting point, but I had to learn very fast how to answer this. At the beginning, I was saying yes and no. I couldn't do that. It had to be scaled. Well, she'd give me another instrument. This is another instrument closer to what we use in the mouth. Well, it comes down, but we can't say PD for this whole instrument. It comes to parts. It's just a handle length PD. Would it pass the PD test? That's handle length. Would the handle dimension? I mean, would this pass PD? It's very, for me to say the whole instrument is PD, it's almost impossible without going through every single part. Now, okay, you can have it. Is the diameter of this mirror PD in comparison to other mirrors, dental mirrors? Yes, in comparison. If you're saying, is the absolute only one for the world? That's coming into a different way of thinking. But in comparison of what we have as a habit, this means this approaches and matches PD movement and position. And therefore, it's very difficult to separate PD use of the body. We can teach only the body use only without everything we use. So this is coming back because in Thailand, the government is wondering whether this should be a government standard or not for the whole country. I said you have to specify its use carefully if you're going to make a so-called national standard. I said yes, for mouth procedures it can be a standard not only for Thailand but for the whole world. If the size and shapes of human mouths change, we'd have to change the dimension of the mirror. But as long as we have the mouth shape, and there's a plus or minus. We have big mouths. I have a big mouth. I grew up and talk so well. And we have small mouths. And we have different dimensions in the mouth. But there is an average where you say, because you always have to think of plus or minus. And what is beyond the limit of our testing. So we got into this very heavily, and I was working closely with many engineers, and they are people who are trained in measurement, of course, carefully, and we went into that, but this is only one item.
これはごく一例に過ぎませんけれども。
The reason I'm showing this is because this was one of the most difficult things. For example, there are two companies who want to, 2 days ago, 2 or 3 days ago, want to make this mirror. They said, very easy. Well, no, it's more than that, because last day I was in Thailand. There's a Thailand company. I'm open. Any company can make it. I cannot say this company is the global company. Impossible for me to have an assignment for any company. PD specifications have to be open to anybody who wants to make it, and if they do it properly. But if they do, they have to be subject to the tests. And who makes the tests? It's not only somebody who uses PD mirrors. It's a person who works in a PD clinic, because there are so many habits around this that if it comes to clinic tests, we have to say, does this person work in a PD clinic? So this is only one small component that fits. This is only one part that fits into a PD clinic. And we have to specify what kind of clinic it is. Well, this is a mouth clinic. Because there's eye clinics and there's all kinds of clinics. So it comes not only into dentistry, but it comes into medical clinicians of all types. That comes to the next step. But then there may be other uses for it, for anywhere that's comparable to access that you have in the mouth. Let's say, well, that diameter, okay, or maybe it's an angle that's adjusted for a different setting. Might say, well, if you're working with this mirror that can enter looking into part of the heart, they might say, oh, we change the angle of this, but the diameter. But you have to go through each specification to decide, each measurement. I'm happy to say that the president of PDP in Japan is an engineer. And he has expertise in measurement, and he's a materials engineer of all things, which comes to atoms thing. That's Dr. Ishida. And so I'm very comfortable with the fact that we have an engineer and a dentist who has accepted being the president of Japan PDP, and I feel his way of thought then is very similar to being able to compare. But in the group, there are members in this group that are especially careful. I think if I'm going to name names here, Dr. Ishida is one, Dr. Sidichai is a very careful person in terms of measurement, and I subject my tests because I'm not practicing now. So when it comes to tests today, I must have it compared with people that in practice that I feel understand PD and work in PD clinics. So in the group, if anybody wants to do any measurements and you have special interest in that, I would like to have your name if you volunteer. Yes, I want to do this. Don't mind any groups that says I have the confidence and the interest to do this sort of thing, to be subject to these measurements. So anyway, that's a problem we do. This is, next is, next I think most of you may be familiar with this because I think I presented this in Japan. And F, we started with the word F in the beginning as saying form. We've changed that focus of attention. F means focus of attention.
という意味でフォーカスをアテンションに変えました。
And to me, this is something we adopted many, many years ago, and I still think it's very valid today and long until tomorrow, especially with interest in PD. The focus of attention, F1, is purpose of acts. So that means F1 is focus of attention on purpose of act. Well, if we're working on this tooth, this is F1. Or if we're working, if we're doing something to fix the point of the arm or any part of the body, that's F1. F2 is the body segment, positions, and acts. When you act, what is the position of each body segment? And then and the relation with all body segments. That's F2. And F3 is any element that affects F2-1 relations. This is where things become complicated. The instrument we use that affects F2-1. F2 and 1 relation is number 1, F2-1. But when it comes to F3, anything we use can change it. And number 1, what we're using in a clinic, the first thing is what is the space? Then many times have drawings. Oh, can I make a PD clinic? I look at the space and I say yes or no quickly. Because if there's not enough space, it's impossible. So, and then we also have time. And we have time points. And how many here use time points? That means that your receptionist is scheduling all treatment accountable to time for each step of a procedure. We call it time point system. You might not be familiar with the name. You're familiar with that. I don't see many hands up at the moment, but some there, up there. Okay. That's time. So you have to have 4 dimensions: space and time. You have to think in 4 dimensions to understand. There are 3 dimensions of space: Z, Y, and X. In a human body, this is the Z, the long axis. The Y is front-back relation. And X is left-right. And we specify in that order. Z is first, Y is second, X is last. But before that, we specify time, T. And we have 3 elements of time. Time is specified in the order of frequency of use, F, duration of use, and timing of use, FDT. I didn't learn any of this in a dental school, I can tell you. I learned this from Leo Perkins, who was an industrial engineer. And what do industrial engineers do? Their job, factories the owners of a factory says, oh, we're going to change the technology in this factory. And in this sense, we are workers. Yes, we are workers when we were fixing tea. And they are workers, so factory workers, and we might have much in common. But Leo of Burke Perkins applied for a job because I needed somebody to write some English translation to Japanese, and he applied for it. And those kind of engineers, industrial engineers, their basic study is human engineering. Is human. Or no, they are human engineers. And their very basic job is to get workers of a factory to accept. If the factory says we're going to update, we're going to change the setting, they have a factory full of workers who don't want to change habits. They know the habits that the company has asked. They feel they're skillful with those habits. And no, the factory changed it. Oh my God, I have to change my habits. And workers can't stand that. That's very difficult for workers to change habits they've had for many years. So the human engineers, because their basic job is to change habits, is to get working people to accept that they must change habits, or else the factory has to either throw away the new technology, or they have to fire the workers. They got two choices. You cannot work here anymore, or you have to change your habit. And workers who refuse to change their habits will probably have to get another job someplace else because that factory can't keep them anymore. This is a big problem, and this is what industrial engineers work with. I'll go a little more into this about Leo, because, by the way, the first courses we had were called home position, BHOP dentistry. How many here remember BHOP? Very few younger people, I don't think, remember that. But that was our first courses. We call it home position dentistry. That was a term I learned from Leo. Home position. By the way, coming back to Korea, Dr. Kim had convinced Korean dentists and all about home position. And then I came and introduced performance logic. And he knew how to convince people on home position. And BHOP and things like that. And then later, I come with an emphasis on PD. Dr. Kim says, please don't get too many names. Because just when I have everybody understand what this is, you go and change the name of the system. And he was trying to match with my interest. So I thought about it a lot, but I think we're going to stay with PD a long time. That's a term. It's very short. PD is very short. It also can be applied as an adverb to an adjective or as a subject. We can talk about the outcomes of it. We can talk about the acts. PD is a very convenient term, just a term itself. So I like it myself. And I'm going so Dr. Kim asked me very seriously, are you ever going to change the name again? Because he was the campaigner for our thoughts more. This has got a lot in it. And
これは大変盛りだくさんでいろんなことが書かれているスライド。
now I want to say that F1, of course, we are dealing with F1 in the mouth. We're mouth
私たち
people.
は口の専門家だということで F1 というのは私たちの場合は口です。
Basically, we're not tooth people. Of course, we're working on teeth a big percent of our time. We know that. But actually, we're always working in the mouth.
主として
So I prefer to
歯
say
の
we
治
are
療
mouth
に
people.
費やす時間が多いでしょうけれども
We have a mouth clinic.
私たちは口のクリニックで口の治療をしているという認識を持つべきだと思います。
And I prefer that we have a mouth clinic, not a dental clinic.
できたらデンタルクリニックじゃなくてマウスクリニックと呼んでほしいぐらいです。
Well, that's our F1 focus every day. Is the mouth. Or, no, this is the mouth. I'm sorry.
で真ん中の絵が口の絵ですね。私たちにとってはこれが F1 です。
A heart surgeon
で
or a
心
cardiologist.
臓の専門医、外科医にとっては心臓が F1 の先生もいるわけです。
Their F1 is the heart. Or, if we're an eye specialist,
あるいは
our
眼科だ
F1
ったら
is
目
an
が
eye.
F1 ということになります。
Depends on what we specialize on. So it depends on the F1. One thing that we're working with and is to get PD uses beyond the mouth
で
and have
PD に基づく体の持ち方を含む医療全体に普及活動を広げていけたらと思っています。
and in our update that we're going to make on our website,
でこのウ
we're
ェブサ
going
イ
to
ト
be
の
having more
更新
emphasis with examples.
今しておりますが、より多くの口以外の事例も載せていきたいと思
But
います。
if you are a very skillful PD operator here, then you probably are very skillful. It's very easy to be skillful. Procedures of the heart, or procedures anywhere. A skillful PD person
そのスキル
can
というのは
quickly change. And who's the most skillful person I have ever? You know, we have tested because in all of our courses we always test the members how much they know already. If they know a lot, we don't have to teach them anything. Or do we have to have a lot of exercises to change habits?
それを調べさせていただくんですが、
So we always have first day we have a test.
初日
How much time do we have to spend
それを
on
調
this
べて
person or this group
その人
to
にどれ
change
だ
their
けの
habits?
トレーニングが必要か、習慣を変える必要があるかなどを調
Maybe
べた
2 days, 5 days,
コースを
many days.
提供させていただくんですけれども、
Well, I have made this test on thousands
何千人という受講者の先生方
in many
に
countries of
対
the
して
world.
各国から来られる先生方に対してそういう
Do you know where I found them? Who I
最も
think
スキルが最初から高いと私が感心した方が
is
昔
the most skillful
いらっ
dentist
しゃい
in
ま
the
した。
world. He doesn't call himself a dentist. He says I'm a stomatologist.
で、外国の先生でデンティストではなくストマトロジストと
But he works in the mouth.
呼ばれている国の方でした。
He is from Belarus.
ベラル
He
ー
was
シから
trained
当時は
in
旧ソ連
the way he
ベラルーシから
learned.
来られていました
He was the most skillful person I ever checked.
今まで
And when I tested him, I have one day of many exercises with them. And I asked him at the end of the day, why did you come here? He was referred by WHO. WHO sent him to
スキ
me.
ルを習得しているように拝見するけれども、なぜこちらにコースを受けに来られたのか
I said, why did you come here to HPI? Because there's nothing I can teach you because
も
you
う
know
あなたに
everything.
教えることは何
In
も
fact,
ない
your
く
skill
らい
is
スキルは最高
beyond.
ですよとお話ししました。
But we didn't find the most skillful person that I've ever tested in the United States,
米国
nor
の
in
先生も
Japan.
日本の先生でもなかったんですね。
We
当
found
時
the most skillful person from Belarus, which is a small country adjacent to Russia.
ロシアの隣の国です。
the tests and the need for habit change, we get a lot of information from that. And he, on the third day, because he was a stomatologist, and this is another thing, we dentists have a dental license. Why do we have a dental license? It's a political thing. We should not have a dental license. We are medical clinicians, and we are included, and we should have a license as a medical clinician and not a dental. I feel that's a big problem we have, that we are separated. We're just another specialist on the body. And that was true, that's what Russia had at that time. It wasn't Russia, it was Soviet Union. It was a Soviet Union. There were no dentists. There was no dental association. When I first went to China, there was no dental association. I was sponsored by the medical association. I think it's time for us to think about deleting our relation to dental association. We are just members of medical association, and that's it. Why? And I'll give an example why. Because if you're skilled, this person, who was a very skillful person, on the third day, he was so skillful with everything. I was just admiring him. I had nothing to teach. He said, the reason I came is because you are trying to make everyone pretty much the same level in terms of skill. That's what you're trying to do, because you're calling it the Human Performance Institute. He was licensed with the medical. Therefore, on the third day, he said, I have some slides, you mind if I show them? So on the third day, he showed me the slides. This is before, during the operation, and after. On this slide, he was doing heart surgery. And this was results several months later about his surgery and before, during, and after. Very difficult cases. This was another case of brain surgery. And I was confused. I said, you're a dentist? Yes. He was confused because he had the right to do that because of licensing in that country, in the Soviet Union in those days. And he couldn't understand why I was so thinking we are locked in the mouth and that's all we do. He couldn't understand it, and I couldn't understand him. But then I began to understand. This person is so skillful with the mouth. So I said, but you call yourself a dentist? He says, yes, because my first skill that I learned was in the mouth. So I consult a stomatologist because that's the first skill they acquired. But he later decided to pick up certificates. So he picked up a certificate to be able to do heart surgery. He picked up a certificate to do brain surgery. He picked up a certificate to do plastic surgery on the face. He picked up a certificate to do injury. He had very severe cases he showed and results. Without question, he's the most skillful person we ever had. So anyone who really grasps PD, we don't have to say we only work in the mouth. If we pick up a certificate, we can work on any part of the body, and we have a right to do that. And that's why we should, one way I think, if we are true PD people, we will try to stop, eliminate dental associations. We don't, dental schools. There will be no more dental school, there will be no more dental association. If we go completely PD, and PD to me is a track to global thinking, and will save a lot of problems for people.
そうすれば一般の人たちにとって多くの問題が解決する
So I hope it's not too far away from here that we will be having meetings of medical clinicians. But today I have to recognize everyone here is a dentist. That's what it is. It's centered. It's centered on finger control. And the relationship to eyes and whatever visual thing. It's centered basically on finger segment control in relation to the forearm, vast majority, and the rest of the body just is set up to present a position where you have the best control. Where's my hips? Am I sitting or standing? Depends on whether I have best control of my fingers. Z on my hip. What about the position of my leg, my knee? It is set up for the optimum control of the fingertip. So if PD moves, it will change many laws related to healthcare. PD has a very, very strong potential to change many things. But we have habits. We can't imagine this. But we should imagine it. There's one of the PD members in Europe. He's from Germany, and he's now in. And also another that is he's from France, but he's working in India. They are having PD courses. We have PD courses in many countries. But Dr. Wolf Nettelmeyer,
先生はヨーロッパでコースをし、それからフランス人の司会してインドのオーロビルでずっと活動を続けてこられたジャック・ベル先生もオーロビルでコースをしておられます。
They are giving PD courses in Europe and mostly India. Those two, Europe and India. And we've asked them to say hello.
活動しておられます。で、実はこの講演の最初からスカイプでつないでおりまして、講演も聞いていただいているんですが、最後に先生方にご挨拶したいとおっしゃっておりますので。
Because they also are centered on PD, and this is a PD meeting. We've asked them to give a call and to say hello. And this is a meeting of the global connection. It's very easy. So we'll open up and ask them to say hello. Is it okay?
Yes. 簡単につなぐことができますので。
Are they online?
Yes, they are.
You ready?
Jack, are you ready to say hello?
This dentist is from France, but he's living in India, and he's a city dentist who works with the city, a very famous city.
オーロビルという大変インドでもユニークな活動を続けている、実験としても言われていて、そこでもう何十年と。
And the other dentist is from Germany, but he's in charge of the PD courses in Europe, in the EU. He works in many countries, in the European countries. And this is Wolf, and this is Jack. And say Jack and Wolf, you are both centered on PD courses, and this group has much interest in PD. So. Hey Wolf, you're very serious there.
Could you say a word to members of PDP group? 皆さんこんにちは。こんにちは。グラフのインドからご挨拶 切です。
Yeah. We're trying to get things arranged here, Jack. Yeah. I can't hear you myself. I'm
日本で行われているミーティングに私たちもこういう形で参加できて大変嬉しく思います。グローバルコンセプトの一つの例ですね。
Can you hear that? Yes. Yes. Wolf, what do you think? Okay.
皆さんとこういう場でお話できて嬉しいです。オーロビルに皆さんぜひ一度お越しください。で、今までにすでに照井先生、谷口さん、鈴木さん、その他何かの先生方来ていただいております。ぜひまた近いうちにお越しください。で、私たちはグローバルサウンドをもとに研修をしておりますので、それも見ていただけます。まあ00とかタ00と英語ではなくてグローバルサウンドでまあララタララというふうに聞いています。ウルフ・ネーデルマイヤ先生、1ヶ月こちらに一緒に仕事をしてくださっています。皆さんっておっしゃってるので、
Okay.
こんにちは。
Wolf has many courses in Europe, many countries, and but he spends two months a year in India.
Excuse me, he's talking.
Pardon?
He's talking now.
They're talking.
Okay. Yes.で、先ほどのスライドで F1、F2、F3 の説明がありましたけれども、私たちも今同じように ｐｄ の、教育をしているところです。大学新卒の歯科医の先生が来られていて、非常に熱心に、pt、tt について、学んでいただいているところです。で、このようなグローバルな知識をインド、また EU の圏内でドイツ、フランス、その他の国で普及することができる、そういう普及活動に携わっていて、幸いだと感じています。ぜひインド、ヨーロッパにも先生方お越しいただきたい、ご連絡いただきたいと思います。ぜひコラボレーションを続けていきたいと思います。Excuse me, could you say it again? I'm sorry. で、一つの地元で、その地元の人間だけが活動をしている場合にはグローバルと言い難いですので、ぜひ、他の地域の先生方のグローバルなインプットもいただきたいと思います。では大阪かチェンマイでまたお目にかかりたいと思います。先生方、ハッピーサンデーをどうぞお過ごしください。Thank you. you. Thank you. 今日は本当に参加させていただいてありがとうございました。
Okay. Well, okay. Thank you.
本当にグローバルなミーティングになったと思います。
Now, with global technology such as this is Skype. It doesn't cost anything.
で、スカイプは無料なので本当にグローバルなテクノロジーと言えると思います。
This global things are free because things are going that way.
だんだんこういう方向に世界が動いていると思います。
And PD is a global concept necessary for global, and therefore we have people teaching global in many countries. Wolf is a key teacher. He was studying, but he's a very careful person in terms of authority. He's from Germany, and of course we have other teachers from PD in many countries. But Japan, of course, is recognized for doing a lot to handle PD. Much of the technology that was highly specified started from Japan. And so Japan is just another nation. But this is global. And this kind of technology is spreading very fast. And I would be able to have, if a microphone was set up, we could be, but the problem is global language. They teach mostly with digits because digits are global. The body parts, we already know. What's the global name for this tooth?
この歯のグローバルな名称は名前は何でしょうか。
Meaning chuseshi or something like that in Japanese, in German, and we have many names. If we
母
want.
国語ではいろいろな名前があります。でもグローバルな名前は一つです。
What is the global name for that tooth?
何でしょうか。
One.
11ですね。
But Jack is going further. 11 is English
で
sound.
もオードビルのベルセンスはさらに一歩先
He's
に行
making
って、
global sounds.
ワンというのは英語です。で、それを母国語ではないグローバルサウンドで地元の
The global sound for this
人たちのトレーニングをしています。
le le. Le le. All teeth is la. We have la le ni lu lo and la le lu lo.
0
And
から
he's
9
teaching
ま
that
でのそれぞれの数字の
because it's very easy
音
to
というの
learn the
が
count.
グローバルな音が割り振られておりまして、それを使ってトレー
And
ニングをして
we
います。
know the print is already global. Digital print.
数字は印刷されたものはもうグローバ
Everywhere
ルど
you
こで
see
も通じ
one
ます
is
1
one,
とか
and
それを
two is two,
声
and
で
three
出
is
して呼
three.
ぶときに、それぞれの母国語とか英語が使われていますが、それをオールビルが一歩先を行ってグローバルサウンドで。
And this counting system that started with 0 started in India. No, not in India. There was that before the nation. India is a nation. We don't talk about nation. It started in the Hindu culture. Hindu culture.
で、1から普通は数えますが、0という概念は、ヒンズーの文化の中で生まれてきました。インドというと国の名前になりますから、国名は私は避けないので、ヒンズー文化で生まれたと。
So our members in other countries are teaching everything in digits as much as possible.
できるだ
Not,
け数字
cannot
の
be
教
100%
えを
yet, but we're trying to have
100%
only
すること
global
はどうに
terms.
しても
So we'd like to introduce this in Japan too, in the group PD, because those who take interest.
の会の先生方も関心を持って取り組んできていただいていると思います。
However, we know that you're working on patients every day, and what you're doing every day is number one for in your terms. But if PD is going to be your global interest, we hope that you will be able to. And the members have done a lot already, and I want to thank all the efforts that have made so far. Say, was this the end of the time we're working overtime? With this Nan. Now, she said you can't talk forever, so I better let it go. Everybody's getting hungry. Okay, well, thank you very much for your time and your attention. Well, I look forward to seeing you this evening.
大体お腹が空いたようなんで